Hello and welcome. My name is Alex Poppin, PharmD, and today I'm going to give a crash course on how to successfully present journal clubs. Journal clubs are a staple of healthcare rotations and are used to assess the student's ability to analyze and interpret trial data, communicate it concisely and at a high level, as well as understand the potential real-world applications of the trial results, aka how it fits into practice. Journal clubs are also a helpful way for preceptors and other healthcare professionals to stay up to date on current medical literature. Again, please note that this is not meant to be a comprehensive review, and I am not an expert on biostatistics or journal clubs, but I do feel confident that today's review, sharing my own little experiences, will help boost your own confidence when presenting journal clubs. So let's get started. Journal clubs are 90% preparation and 10% presentation, meaning that to have an overall successful journal club, you can't skip the groundwork. What preparation for me involves is reading the entire trial, organizing the information, and reading the trial again. When you're presenting on a trial, you should be very well versed in it and understand it with a certain degree of confidence. Again, the preparation aspect of journal clubs can't be understated. The supplementary appendix is a great resource that often gets missed, but oftentimes it has clarifying information on study design and specific outcome data not reported in the formal trial article. As I'm going through the trial the first time, I like to organize the information using a template to make sure I catch all the vital information. And then I just keep rereading it until I feel confident on my own understanding of the trial. Now that we've gone over the preparation aspect, let's discuss the actual presentation. And here are some key considerations to keep in mind when you are presenting. First of which, journal clubs are presentations, not readings. I'm sure that whoever you're presenting to can read your journal club article on their own time, so they don't need you for that part. So a word-for-word read-along is not the way to go. Think of it more as a follow-along with the flexibility to go into more or less detail during the presentation. In terms of how to structure it, I like to spend roughly 30% on the actual trial design and 70% of the presentation going through the results and conclusion. And I do this because results and conclusion are the most important and clinically relevant information, and so it deserves most of the presentation time. Also, most healthcare professionals aren't statisticians, neither am I, which further decreases the overall relevance of that information relative to the actual journal club. So make sure you know your audience. In terms of presentation duration, I like to use the 10-minute rule for a couple reasons. First, journal clubs longer than 10 minutes are a little bit redundant because the audience just could read the full trial in like 15 to 20 minutes on their own time without interrupting their day. Second, it forces the presenter to be concise and focus on the most important aspects of the trial. Again, you should not be reading the inclusion and exclusion criteria word for word, rather saying something to the effect of key inclusion criteria were A1C ranging from 8 to 10% and an estimated GFR of greater than 60 milliliters per minute. Or key exclusion criteria were type 1 diabetes and pregnancy. You can still list more criteria on the actual journal club paper or slide, but don't feel compelled to read off each individual bullet. And third, the 10-minute rule requires some rehearsal to make sure you're within that limit. If not, make some revisions, cut out the excess information, and repeat until you feel comfortable. Plus, the added practice makes for an overall better presentation. After your presentation has ended, be prepared for some questions. In fact, you should anticipate questions. They will likely be related to the results and conclusion section of your journal club, so be prepared to justify your analysis and conclusion, or to clarify the trial results. And be ready with answers with strong rationale and justification. If you don't know the answer, don't panic and hem and ha or try to guess or talk through it. If you really don't know, just admit it and plan on researching it and answering it later on that day. Before we finish up, I wanted to mention some tips that I've picked up along the way with my own experience. When presenting, I like to keep a copy of the full trial on hand just to help when answering questions. So if I get asked for specific information, And if I'm well versed on the trial, I can quickly flip to that appropriate section and find that data very quickly. Presenter notes are another great tool in whichever form it takes. Having presenter-specific information or talking points ready make for a better journal club. So whether that's having notes in your PowerPoint slides that only you can see, or just writing additional information in the margin of your paper copy, whatever works best for you. And lastly, don't mention any information that you don't understand. If you are presenting on a topic of any kind and you don't understand what something means, that's a strong signal to look it up before the actual presentation. If you don't and you mention it anyway, odds are that you'll be asked a question about it, and it's not going to reflect well on you and really decreases the overall confidence that the audience has for your journal club. So if you're really having a hard time understanding something after researching it on your own to a certain extent, phone a friend or ask your preceptor for some insight or guidance. Even though asking for help can be uncomfortable at times, it's a much preferable outcome to the alternative. So that's all I have for now. Again, this is meant just to be a quick guide on journal clubs. If you'd like any more information, please refer to the following resources. I'll list those below when possible. Thank you for listening. If you'd like to see what template I use personally when doing journal clubs, please visit www.highpoweredmedicine.com, create an account, and from there you'll be able to download 10 free trial reviews from the second edition of my book, High Powered Medicine, Landmark Clinical Trial Reviews. Thank you again for listening, and have a great rest of your day.